Welcome to Module 4 of the DPS USRN Onboarding Program Essential Nursing Skills and Competencies. In this module, we'll strengthen your core clinical skills and align them with US accredited standards. Remember, competency builds confidence, and confidence saves lives. By the end of this module, you'll be able to conduct both baseline and focused physical assessments. Demonstrate correct PPE donning and doffing, apply infection control and safety protocols, and complete a competency validation checklist in accordance with CHQI and QSEN standards. A baseline assessment is the complete head-to-toe evaluation performed on admission or at the start of a shift. It gives you a full picture of the patient's condition. A focused assessment targets one body system or complaint, for example, assessing the lungs for shortness of breath. Always document findings immediately in the electronic health record to meet Joint Commission documentation requirements. Accurate vital signs are the foundation of safe nursing care. Check that all equipment is properly calibrated each shift. Follow CDC standard precautions when cleaning thermometers and monitors. If you notice an abnormal value, repeat the measurement, verify accuracy, and report it using the SBAR format. Correct use of personal protective equipment protects both patients and healthcare workers. When donning PPE, remember gown, mask, goggles, then gloves. When removing, reverse the order: gloves first, then goggles, gown, and mask. Use appropriate isolation precautions: contact for MRSA or C. diff, droplet for influenza, and airborne with an N95 for TB or measles. Mastering these steps demonstrates compliance with CHQI safety and QSEN evidence-based practice standards. Competency validation confirms that you can safely perform essential nursing procedures. Most hospitals require annual validation for skills such as IV therapy, catheter care, wound care, and medication administration. Each nurse completes a facility checklist, signed by a preceptor or educator, then uploads it to the LMS portfolio. This process supports CHQI workforce development standards and continuous improvement. Creating a safety culture is everyone's responsibility. The magnet, "Speak Up for Safety," principle encourages open communication without fear of blame. Always report near misses and unsafe conditions. Use the SBAR method to deliver clear, concise handoffs between team members. Now it's time to practice. Watch the 5-minute head-to-toe assessment video. Complete the interactive PPE sequence quiz. Download the competency validation checklist. And upload your signed checklist and reflection to the LMS. All standards and guidelines presented in this module are based on CHQI safety and workforce development. The Joint Commission's Infection Control Guidelines, QSEN Competencies for Safety and Evidence-Based Practice, and the CDC Standard Precautions 2023 Update. Thank you for completing Module 4 of the DPS USRN Onboarding Program. Continue practicing these essential skills to build confidence in every clinical setting. Remember, competency builds confidence, and confidence saves lives. This program is proudly presented by Dreamers Park Solutions LLC.